Honorable Prime Minister.
Mr. Speaker, thank you. All of us, Mr. Speaker, wants to get to the bottom of this occurrence that led to the death of little Adrianna Younge. While together we mourn as a country, we've already taken action as a government to facilitate the independent inquiry. Today, as all of us, Mr. Speaker, know by now that we have in progress the post-mortem, Mr. Speaker, being conducted by independent. Mr. Speaker. No, we got into debate. Mr. Speaker, I wish to.
Honorable Prime Minister, let's hear the opposition chief whip.
Thank you, Mr. Speaker. My apologies, PM. Mr. Speaker, just for clarity, has the motion been accepted and are we now into the debate?
As a matter of clarity, this is not only a very sensitive matter, it is one that we all need to put our positions. Normally, such presentations from the move of the motion takes about 2 minutes. And I allowed the honorable member who has proposed the motion to make a full presentation. It's only fair I allow the Prime Minister to say what's happening.
But
Thank
Mr.
you.
Speaker, I applaud you for allowing the speaker the member to go beyond the 2 minutes. But that being said, he presented a motion, and in order for us to continue, it has to either be accepted or denied.
We have done this before. I have a number of years' experience in this House, and all items under the standing orders. Honorable Prime Minister, you may continue.
Mr. Speaker, I wish to
this is
bring.
unacceptable, and we will not party this.
Mr. Speaker.
So you may continue. The microphone.
Mr. Speaker, I wish to bring to the attention of the House a document dated the 25th of April 2025, prepared and disseminated by the Guyana Police Force, handling reports of missing children, persons, standard operating procedure. And in this document, all the changes that are necessary is incorporated in this document, Mr. Speaker. And for the purpose of the House, I shall state the important aspects, the key provisions of this new policy that is prepared by the Guyana Police Force. Immediate response. All missing person reports must be acted upon without delay. This is a major change from before, where we had a mandatory 24-hour waiting period. Now, all missing person reports must be acted upon without delay. Activation of red alert. A red alert will be immediately issued for any report involving a missing child, triggering a national coordinated response. Risk classification. Special attention will be given to children, elderly individuals, and persons with disabilities or vulnerabilities who will be classified as high risk, warranting immediate deployment of additional resources. And interagency coordination. The force will continue to work collaboratively with the Child Care and Protection Agency, Immigration Department, health institutions, shelters, and other critical partners to ensure a comprehensive and effective response. Public awareness. The Corporate Communications Unit of the Force will disseminate timely and accurate public notices regarding missing persons upon authorization from the Office of the Commissioner. Senior oversight and accountability. Divisional commanders and the Missing Children Persons Unit, MCPU, will maintain daily oversight of all active investigations and provide regular updates until each case is resolved. Additionally, the heads of services, including the Chief of Defense Staff, Chief Fire Officer, and Director of Prison, will be notified promptly by the Commissioner of Police in all cases involving missing children or vulnerable individuals. Mr. Speaker, this new SOP will be gazetted on the 29th of April, that is tomorrow. And Mr. Speaker, I wish to remind this House that even before these changes, we already had a child care and protection agency that falls under the ambit of the Ministry of Human Services and Social Security that has already been exercising responsibility for the protection and welfare of children throughout the length and breadth of Guyana. Its actions are governed by the 2009 Child Protection Act. Mr. Speaker, within the last 4 years, the Ministry of Human Services and Social Security launched the Every Child Safe program, which continues and encompasses the following to develop safer communities: training of civil society and children in all communities on keeping children safe by recognizing the signs of abuse and having a low threshold for reporting instances of abuse. Directly working with children to apprise them of the laws and also to encourage reporting. Addition of 914 hotline, in addition to a dedicated child protection hotline to increase reporting of cases of child abuse. The removal of children to shelters or state care to offer protection. The provision of socioeconomic, psychosocial support to all children who experience abuse, including trauma, focused counseling included. The continued training of CPA personnel to deliver services to children in all the support areas, including grief and resiliency. And I'm aware that such action is taken where today we have a unit from the CPA is currently at the school attended by little Adrianna Younge. Ministry of Education, sorry. They are at the school attending to this whole issue of grief and counseling for the students at the school attended by little Adrianna Younge. A parenting program to work with parents on care of children and to prevent abuse across communities. Training of persons across all regions who run daycare on child protection in addition to early childhood development. Collaborative work with the Sexual Offenses DV unit to tackle violence in schools, going into schools and working with children. The increased subvention to NGOs to establish child advocacy centers in all regions. The passage of the Family Violence Act, which also protects children. The Streetlight Program, which removes children off the street and offers protection and care. Through the Family Enhancement Services Unit, development program with support and training from USAID to work with youth at risk and their families and to prevent delinquent behavior and intervene where juveniles are most vulnerable. The development of a rapid response program to respond immediately to reports of child abuse. The Community Clean Sweep program to go into communities and unearth and address all cases of child abuse with a dedicated team. The anti-bullying and anti-body shaming programs and campaigns. The expansion of the foster care program to place children in home environments to have safety, security, and love. Training of the police and persons in other agencies in a dedicated effort on the Child Protection Act, the Teen Pregnancy Prevention and Protection Programs. These are all initiatives that are geared towards protecting our children. Mr. Speaker, I take this opportunity to remind the House that our government have been making policies and implementing programs throughout the length and breadth of Guyana to safeguard our children. From an economic standpoint, we have the Because We Care cash grant. We have the payment for newborns. New schools are constructed. New children advocacy centers are being constructed. And hope and justice centers. Hotlines to report child abuse and domestic violence. New Family Violence Act. New Combating and Trafficking Act. Family court. Health programs for eyeglasses. These are all measures aimed at helping our children. New hospitals and upgrading of equipment and services at health facilities across the country, including telemedicine. Training of police to handle children and domestic and sexual abuses report. These are all aimed at improving the welfare and the protection of our children, Mr. Speaker. This is my response in regards to the honorable member's motion, Mr. Speaker. Thank you.